most of my patients, one of the concern is how they concern about how they need to exercise, and I always explain to the patient the importance of the exercise. So this is my honor. I have a doctor of physical therapist, and she will explain just briefly about 10 minutes the importance of exercise for the patients. So thank you.
Yeah, so a lot of it has to do, when you're going to acupuncture, a lot of times you're dealing with a lot of global inflammation. So when you have global inflammation in the system, the best thing you can do is to move. So especially when you have pains where you're sitting or standing and you're just not moving for any period of time, then generally movement seems to help because you're getting the flow going. Just like in the acupuncture world, it's kind of like this chi motion, right? So you have to get your energy flow going in order to release some of the pains that you're having. So not all exercise is created equal. So so the best thing you can do is move, but in a way that is not stressing the body. So so you have to listen to your body and kind of not overdo, but also continue motions. Static stretching, oftentimes people push that, but in general, I find that like things like yoga and Feldenkrais and those kind of movements that are gentle for the body, where you're asking for symmetry, are actually more beneficial for you and kind of more active. So you're more in control of your system, because oftentimes what's tight is not the muscle, but it's actually the nerves. And when the nerves are tighter than the muscles, when you stretch them, you can actually aggravate things. So yeah, so that would be my 2 cents on movement. In a general sense.
Yeah, right. That's right.
Does that help?
And then, so how about like a Pilates? Like, do you recommend
Pilates is good, and I would say Pilates and yoga are good because they actually help you to breathe. And a lot of the other part of pain is a lot of times for healing. One, we need sleep. Sleep is absolutely more important than movement or diet or anything. So if you can focus on your sleep, that's better. But second, your vagus nerve tends to be on restriction. So you have generally people who have pain all over the body also have the vagus nerve restriction, and that's linked to all kinds of systemic problems. When you do things like that involve breathing and controlled breathing, those systems are allowed to relax. It helps calm the whole nervous system. So when you're focusing on diaphragm breathing, as you do in yoga and as you do in Pilates, it's really helpful for the body overall to kind of go back into that parasympathetic rest and digest phase instead of constantly being in a fight or flight phase. So it helps with the mind and the body. Pilates, I like because it's also focusing on neutral, finding your neutral, being aware of what neutral is, and then being able to move your arms and legs within that neutral. Yoga I like because it teaches you how to have control at your end ranges. So they both have really good things that they do for the body.
So usually you recommend like either like a yoga or Pilates? Right?
Yoga, Pilates, general walking program. Those are some good things. I mean, there is a good benefit of cardio as well, cardiovascular exercise, because that really does help. But sometimes even just moving more, deciding to, go up the stairs instead of, if you don't have a lot of knee, lower leg issues, instead of going up the elevator or deciding to park a little bit further. Those things actually improve your activity as well and get you moving a little bit more. So it doesn't necessarily have to be, I have to set aside 30 minutes every day to go on a bike or a treadmill, but it could just be, move a little bit more.
Okay, thank you. So, and then also, one of the frequent the question from the patient is usually patient asking me like with the acupuncture treatment, it's okay to go to a physical therapist. So what is your opinion, between acupuncture and physical therapist?
Yeah, I think that they're an excellent adjunct. I think
Oh, I see.
acupuncture is amazing because it's really helpful with the global inflammation, the treatment of the vagus nerve, the treatment of some of these other systemic things that make it harder for the body to heal.
I see.
And then to go and layer on top of that how you should be moving, how you should be stacking your body up so that you have access to the core that you already have. Those things are really valuable too. So I think the combination of the two really brings it to a whole nother level of healing.
Okay. So, and also the one of the frequent question is just like a patient asking me, of course it depends on the pain area, but in general, if patient have a pain, patient ask me what kind of exercise do I need it? Maybe just one of the frequent pain is probably low back pain and then neck pain. What do you recommend? Exercise?
Yeah, so generally they're postural type exercises, and it kind of needs a little bit more evaluation and to see what people are lacking in doing. But I oftentimes point them to certain kinds of, I like Feldenkrais lessons for movement. Those are usually pretty gentle, and they are things that you can go on YouTube and kind of look up. And they usually aren't the things that are going to aggravate the patient, like going to a CrossFit class or something like that.
So, when you recommend exercise, how often, how long, and then what kind of usually do you recommend, just like in general?
How often? Well, I mean, like I said,
How long or,
yeah, like I said, it doesn't necessarily need to be the recommendation from the American Heart Association, I believe, is 3 times 30 minutes.
I see.
But I think that moving more every day is probably the best thing. I don't think it's one number for every single person. If you're dealing with a lot of pain, asking you to go and do 30 minutes, all at once is probably too much. So maybe it's, 10 minutes 2 or 3 times a day. So it doesn't necessarily, it's not a cookie cutter answer. Everybody's different. Everybody's going to have to find a different way to fit it into their life. But you find something that you like, you enjoy, that also makes your body feel better, and that's what you do.
Okay, great. So one lesson is that nowadays so many people they are stressed because of the COVID, the pandemic situations. So,
Right.
what is good exercise for stress management, or sometimes they have a sleeping problem. So what is in general, what is the best exercise?
Yeah, for myself personally, I like taking yoga classes. I do yoga on Peloton yoga, but you can choose whatever you want to do. But I think breath work really helps. So if you can spend a little bit of time on your breathing, generally that'll help down train your nervous system and take you into that rest and digest phase in your body, and that allows you to kind of calm down and feel better.
Oh, okay.
Yeah.
Yeah, great. So, so I'm so happy to have a doctor, physical therapist, and a little have a good advice about some exercise. So, so hope everyone just helpful for this information. Okay, thanks so much.